immunotherapy has kind of lagged behind in the blood cancer space, not for lack of trying. It just hasn't been as effective as it has been for patients with solid malignancies or even some of the other, like lymphomas, for example. Um, I think there are certain immunotherapies that I think are highly likely to be successful in AML, maybe even in MDS and myelofibrosis. For example, magrolomab, the anti-CD47 "Do Not Eat Me" a blocking antibody. I think that is an example of modern day immunotherapy that could really bring significant improvements to outcomes in patients with AML, MDS, maybe even myelofibrosis, but also vaccine therapies. So we here at Mount Sinai and others have developed vaccines against what are called neo-antigens, or proteins that are expressed almost exclusively by the um, malignancy, like the myelofibrosis cells, like the calreticulin, the mutant calreticulin protein. So we have a vaccination strategy against that, and we're anxious to see in patients who have these CALR mutant disease whether we can have success there. And then I think most excitingly, and from the ASH plenary session, was the mutant CALR antibody made by Incyte, and that's going to start in June or July of 2023, using an antibody against the mutant CALR in order to try to selectively deplete those abnormal cells and even wipe out the clone. It looks great in preclinical studies, and unfortunately, a lot of things look great in preclinical studies. They don't always translate neatly and effectively into humans, and it's hard to recapitulate that to humans. But I am anxious to see whether some of these immunotherapeutic approaches, whether they're vaccines, antibodies, have the potential to be transformative in these diseases, like we've seen in solid malignancies.